From the Ministry of Health perspective, we are quite clear that we are COVID contained and we have met the criteria for what we consider COVID contained. In that we've had 18 cases, we knew how each individual got the disease, and we knew who they spread it to, and we were able to put a containment measure around them. We also know that from all our other surveillance data, in other words, we have been testing people outside the high-risk group. We have been testing everybody who's been admitted into our ICU with respiratory symptoms. We've tested all the medical personnel who have respiratory symptoms. We've picked select groups that we know that are very likely to get COVID-19, and they all returned a test that was negative. We also had another surveillance system that is able to record the total number of cases with COVID-like symptoms throughout Fiji from 67 sentinel sites. And in actual fact, the COVID-like illness symptoms, the incidence of COVID-like illness is less. In other words, our number of flu cases are much less compared to other years. So all these things all tell us that yes, we have gotten ahead of our first wave. But we recognize also that one of the side effects of all our attempts is that there has been a lot of loss of livelihood. We are acutely aware that the health impact of loss of livelihood is something that is as dangerous as the health impact of COVID-19. In the sense that we have seen it in the past where where somebody is not able to afford bus fare, not able to afford transport, not able to afford the proper food, has a adverse health impact on in terms of the people that we see coming to hospitals. So, based on the fact that we are clearly cognizant of the need to balance the health, preventing the health effects of COVID-19 and preventing the health effects of low socioeconomic status. And many of us medical personnel have been around Nandi for most of yesterday, organizing something for some repatriation people. And we are quite aware that there's a lot of people who are looking for alternative ways of putting food on the table. So what we have come up with and what we have advised is that we will have to put in place some measures that will allow us to engage economically. The acute phase has allowed us to strengthen or medically put in more medical input into our border control measures. So now we are putting a lot of medical criteria into people that are wanting to come into Fiji. The acute phase also strengthened our medical readiness. And the three areas that the medical readiness was strengthened especially was in our ability to surveil and respond to any acute outbreaks. It allowed us to enhance our clinical care response, and it also allowed us to maintain ongoing audits of our various medical facilities, just to make sure that they are functionally ready to respond when they are required. One of the other bits that we are also doing is trying to remodel the way that we provide service so that we are able to reach out to people who are sick and sort out their problems closer to their homes. That requires a whole different way of providing a service that we are currently going through in terms of planning. We feel, and then the last part that we did was that we sent out teams to go and help people set up your workplace plans so that you could create a COVID-safe environment as you engage in getting livelihood. The last one is the one that we feel is really important for us medically. There's a lot that we don't know about the virus. We do realize that despite all our stringent measures, occasionally a virus will get into the community. We may not know it, But we are hoping that if the community is able to apply all the COVID-safe measures, the virus will be stopped on its tracks. The virus requires human beings to pass it from one person to another in order to survive in the community. And as long as we are able to work away so that it comes into the community, it may take 1, 2, 3 people and then stop. We have latitude to engage in livelihood because we are safe in the way that we behave. And that is really the crux of where, as a health group, we are coming from, that we are asking all our leaders to please, community leaders, to please, keep working on our COVID-safe measures that are outlined. I don't have one of those blue, but I think they are available online. That's right. This is available online, and we are asking all our community leaders to ensure that there's a lot of COVID-safe measures in place. A typical example would be all the small markets that are coming up. There are some places where I'm feeling that we're getting close to not complying or not being COVID-safe enough. I must admit, I wish I had some time to come and plan out the meeting today. That would have been a little bit more different from what we have right now, but it is what it is. My point being that the more we engage in the community to engage in COVID-safe measures, the greater latitude we will have to indulge in getting, opening up our borders, getting tourists in, doing a lot more livelihood-related activities. So I think that I personally, and most of my staff in the Ministry of Health personally, we believe that we are in a good place. We have a number of ongoing work that we will continue to do to strengthen our borders and strengthen our level of medical readiness. I went to Lautoka and Nandi yesterday. There are empty spaces with ventilators and airvols all ready to be used, not being used, because we are waiting in case it needs to be used. So that's the state of readiness I'm talking about. There are empty rooms, and it'd be nice if some people can go up to Lautoka and freshen up those rooms a bit more. It'll be really, really good. They require a little bit of painting, but they are ready for use. So with all those medical measures in place, we are hoping that we are now in a state of readiness to respond should any of the risks that we are worried about arise. Thank you.